So hello guys, how are you? It is the Kulsum and Amna Intensive Healthcare Sciences program, and we are continuing toward the MS 4 years in General Surgery program. So it is the Kulsum Amna Intensive Healthcare Sciences program, and we are studying the 4 years curriculum in the General Surgery of the University of Health Sciences, Lahore. So today we will have another topic related to the assessment of the acute uh, abdomen, related how to assess the abdominal diseases, surgical infections, abdominal surgical infections, and etc. Like how to study abdomen. So let's see. Abdomen, ABDO, abdomen surgical infections, abdomen surgical infections. Abdomen surgical infections include the types of abdomen. Superficial incision involves only skin and the subcutaneous tissues at the incision site. Deep incision, organ space incision, in which the organ and space is insected and dissected and are accessed. Specific infections and treatments include antibiotics, drainage of the abscess, that is also known as pus, and surgery of the reinvention to clean the side wound. Care prevention include antibiotics, sterilized technique, sterilization of the equipment used in the surgery, pre-operative care, proper skin preparation, managing blood glucose, maintaining normal body temperature, surgical site infection following abdominal surgery, surgical site infections. So let's study this article. Surgical site infections following abdominal surgery. Surgical site infections. Type of surgical site infections include the following signs and symptoms of the surgical site infections. Superficial incision may produce pus from the wound site. Samples of the pus must be grown in a culture to find out the type of germ that are causing the infection. A deep incision may produce pus. The wound site may reopen on its own. A surgeon may open the wound and pus inside the wound. An organ show discharge of the pus coming from drain place through the skin into a body place, space, or organ. A collection of pus called an abscess is an enclosed area of pus and disintegrating tissue surrounding by inflammation, and also known as pain. And abscess must be seen when the surgeon reopens the wound or by special X-ray study. Causes and risk factors of surgical site causes and factors. Clean wounds. They are not inflamed or contaminated and do not involve operating on an internal organ. Clean contaminated wound. There is no evidence of infection at the time of surgery but do not involve operating on an internal organ. Contaminated wound. Dirty wounds. Other risk factors for the surgical site infection include having surgery that lasts more than 2 hours, having other medical problems or diseases, being an elderly adult, being overweight, smoking, cancer, weak immune system, having diabetes, emergency surgery, having abdominal surgery. Help prevent surgical site infection. Treating surgical site infection. Help preventing surgical site infection. Doctor reduce the risk for surgical site infection. It is important to stop smoking before surgery and to tell your surgical team about your medical history, especially if you have a diabetes or other chronic illness. And also avoid shaking the skin area that surgeon is planning to operate through. No matter how curious they are, the loved one should not touch your wound or surgical site. Carefully follow your doctor instruction about wound care and surgery. Call your doctor if you have developed a fever or pus, redness, heat, pain, or tenderness near the wound, or any other sign or symptoms of a surgical site infection. So let's see the infections of the MBBS course of videos. Let's see the infections of the abdomen and digestive system. Gastrointestinal tract infection involve the following: hepatitis A, viral infection, retrovirus, astrovirus, fungal, protozoa. So let's study the gastrointestinal infections. This Salmonella infection when bacteria called Salmonella live in the intestinal tract of animals, including birds. Salmonella usually transmitted to humans by eating food contaminated with animal feces. Every year, nearly approximately 10,000 cases of Salmonella are reported in the United States. Salmonella very serious. Blood infection may be serious, especially in the very young or very old. Typhoid fever is the most severe type of Salmonella infection. Can Salmonella symptom? Where do Salmonella get cured? Often no treatment is needed. Infection run in 3 to 4 to 7 days. No infection treatment is needed, but you have severe diarrhea. You may include rehydration with intravenous fluid and antibiotics. When do Salmonella symptoms start? Within 8 to 3 days after exposure. Most healthy people recover within few days or to a week without a specific treatment. So let's see these are some of the types of the bacterial infection of the gastrointestinal tract. Let's see the hepatic infections. Hepatic infections. Hepatic hepatic. Is an inflammation of the liver. Inflammation of the liver. Let's see what the inflammation. Localized in the body becomes swollen, hot, and often painful, especially as a reaction to a injury or infection. A, B, C. Parasitic bacteria or toxins include fatigue, jaundice, abdominal pain, nausea, and fever. With treatment depending upon the cause of antiviral to virus to supportive care for alcohol-related issues requiring medical diagnosis and management to prevent severe liver damage. Viruses include hepatitis A, contaminated food, water; B, blood, serum; C, D, E, contaminated water, food, fluid, etc. Parasite in organisms like can cause pus, often from contaminated water, food, bacteria, and fungi. Less common but can occur especially in those with weakened immunity, causing fever and pain. Toxins. Fever symptoms include the following. So let's study what the hepatitis A really is. Hepatitis A. What the hepatitis A really is. Highly contagious liver infection caused by a virus is a severe type of hepatitis virus that can cause liver inflammation and can affect your liver ability to function. Contaminated food or from close contact with a person of origin and mild cases of hepatitis A don't require. Symptoms include the following: when to see a doctor, hepatitis A, liver infection caused from contaminated food, hepatitis A causes. Let's see the causes of the hepatitis A. Uninfected person ingests food or water contaminated by feces of an infected person. Common causes include poor sanitation, improper hand washing, and close contact. Contaminated food and water. Consuming food prepared by an infected person who do not wash their hands. Eating raw smell fish from contaminated water or drinking contaminated water from the contaminated sources. Person to person contact. Environmental exposure risk factors include the following: hepatitis A, hepatic infection. So let's see the surgical infections of the surgical infections. Let's see the let's see what the stomatitis, stomatitis is, stomatitis. Let's see the clinical inflammation and ulcer. Mouth membranes often cause redness, swelling, burning, and difficult eating caused by infections, trauma, or chicky food, puree filters. Stomatitis, local neck swelling, breast lump, breast pain, nipple discharge, dysphagia, restore. So these are some of the surgical infections related to abdominal mass management, lower G, gastrointestinal tract bleeding, and etc. like that we will study in the next lecture. At the 50 minutes is over. That is the duration of the lecture on the YouTube. So that's all for today. Pray for their best cause, for their best of their departed souls. Rabbana atina fid dunya hasanatan wa fil akhirati hasanatan wa qina azaban nar. Khuda hafiz. God bless us all. So hello guys, how are you? It is the Kulsoom and Amna Intensive Healthcare Sciences Program, and we are continuing toward the MS 4 years in General Surgery Program. So it is the Kulsoom Amna Intensive Healthcare Sciences Program, and we are studying the 4 years curriculum in the General Surgery of the University of Health Sciences, Lahore. So today we will have another topic related to the assessment of the acute abdomen.